Okay, I'm sure you are all familiar with what is coronavirus. If not, you can just ask Dr. Google, Dr. Safari, or Dr. Bing, and they will tell you everything about this pneumonia of unknown source. So, if we go to the CDC website, you can see that now the coronavirus has affected more than 60 countries in the world. And if you click on this link, we can see that more than 10 states in the US have at least one confirmed case of the coronavirus or COVID-19. And because of that, maybe because the elderly is a distinct and unique segment of the population in any country, and it's a no-brainer that this virus is going to affect this segment of the population maybe in a different way. And we all know the elderly in any country, the US included, has a critical, unique and complex healthcare needs. Due to all these reasons, they have multiple medication for all these health conditions or chronic illnesses. They are more prone to falls. They may have cognitive, sensory and functional impairments that requires medication. And they may have chronic illnesses like diabetes, high blood pressure, hypertension, stroke, arthritis, or they may also suffer from dementia, Alzheimer's disease, or kidney and bladder problems. All these illnesses or all these health concerns oftentimes requires medication and different types of medication. And sometimes polypharmacy is also involved in the elderly segment of the population. Polypharmacy, if you Google this word, it means taking different kinds of drugs for the same medical condition. So, because of that, the elderly population has a more critical, a unique, and a more complex healthcare needs than the general population. And because of that, it is logical to assume that the coronavirus may impact this segment of the population in different ways. And it's a no-brainer. The elderly or the very young, but we are focusing on the elderly in this case, may have a weaker immune system than the younger, the middle age, or the teenage population. And because of that, they may be affected by COVID-19 in different ways. And if you just Google something like this, all these newspaper sites or news websites or certain websites maintained by universities, they will tell us why the elderly may be more prone to the coronavirus than the other segments of the population. If you just Google something like this. And even though many of the elderly population in the US, or some of them, or a portion of them, may be covered by Medicare and Medicaid, but doctors are less inclined to see elderly patients because of the reduced payments associated with these schemes. So, doctors may be less inclined to treat elderly patients, and these may make them more vulnerable to COVID-19 or the coronavirus. And because the elderly population have complex healthcare needs due to the chronicity of these illnesses, we call them comorbidity. You can Google this word as well. And this can be another reason why doctors may be less inclined to treat elderly patients even before coronavirus was discovered. Doctors sometimes may be less inclined to treat elderly patients because of the reduced payment and because of their more complex health issues. They may have all these issues or those not stated here simultaneously, and this can create the higher liabilities for medical professionals. And because of that, doctors may be less inclined to treat elderly patients. And doctors may also be less inclined to treat elderly patients because of the complex insurance filing procedures. So, these are the three reasons I can think of why doctors may be less inclined to treat elderly patients, and partly because of that, the elderly patient may be more vulnerable to the coronavirus if, God forbid, they get infected. And we all know from the case in China, we see that sometimes a disease, they started at the local level and they can progress to infect almost everybody in one community, and the level of infection can even increase to a larger area, like the whole city or the whole state or the whole region within the same country. And because of that, to treat coronavirus among the elderly, it requires a lengthy course of treatment. It requires redeployment of resources or additional resources, and it also, due to their complex or chronicity of illnesses, to treat elderly patients with coronavirus, it also requires specialized care. And to ensure protective actions are taken in a timely manner, I can think of two things that needs to be in place. First, we need to have a logistical emergency plan even before the disaster strikes. We need to have adequate planning, and we need to know who are in charge of the major and crucial operations in a given setting, like a hospital, and who are in charge of the financial and other crucial functional requirements. And because it's still unclear how and whether the disease is going to spread, it's good to have a good planning to anticipate future resource allocation for this cause, and to have adequate funds in case we need other forms of deployment. And it's always a good idea to get our workforce ready so that they are willing and able to respond in case there's an emergency. And if you Google something similar to this, you will find out that There's a diversity among the elderly population in any country in the world, regardless of their economic, social, and political system. And I'm sure you noticed some of the big guns, the CEO, the board of directors, and major publicly listed corporations are the older adults, those 50 and above. They are doing very well. And some elderly population, they experience a decline in standards of living after retirement. So this tells us that there is a diversity among the elderly population in any country. If you just scroll through the search results, all these results through different numbers and statistics will tell us that the aging process itself is diverse and the elderly population in any country is diverse. And I think recently Vice President Mike Pence, he did a press conference or several press conferences, and he did mention that it's important to focus on the specific healthcare needs of the elderly when preventing the spread of coronavirus.